Welcome to my YouTube channel. My name's James Frizzell from Niagara Falls. It's Monday, May the 15th, 2023. We're covering the topic of child abuse, recognition and reporting for all dental staff. And this was originally broadcast on Monday, May the 1st, specifically for the audience from the Ontario Dental Assistants Association from Northern Ontario, the Simcoe North Bay area. And we want to thank again Lisa Pattison for inviting me to speak on this important subject. So anybody that might have missed that Zoom meeting on May the 1st, we're rebroadcasting this on the YouTube channel so you can catch what you missed on this presentation. And just a note, I also do Zoom meetings on the topic of domestic violence, and I cover the topics specializing in non-fatal strangulation and intimate partner abuse concussions. Here's a trigger warning. This presentation includes photos and descriptions of child abuse, which some attendees may find very disturbing, and if that is the situation, just shut off the video. And I'm not qualified to give counseling, but you could, if you need to seek counseling where you are from a professional counseling. And we're going to look at this statement here regarding the dental team, specifically the dental hygienist and the dental assistant. And they play an important role because they're more capable of forming a trusting relationship and obtaining information from a suspicion of a child abuse victim who's a patient in our chair. So they're less likely to confide in me, a dentist. They're more likely to confide in and form a trusting relationship with the dental hygienist and the dental assistant. Here's a study where they said this was, by the way, by the American Dental Hygienists Association in the Journal of Dental Hygiene from winter 2005, the perceived likelihood of dental hygienists to report abuse before and after a training program. And what they found out is after being trained in recognizing child abuse injuries, there was an increased rate of reporting as the hygienists were more well trained in recognizing child abuse injuries. So the most important thing to know about reporting abuse is that it could save a life. Children die every day from injuries caused by child abuse. Often someone was aware of the abuse, but they didn't report it. And just briefly, the four main areas of abuse, four types of abuse: physical abuse, sexual child abuse, neglect, and emotional abuse. We're going to focus in first on reporting. And step one, we would report to the Children's Aid Society and possibly to the police also at our discretion. And then documentation is important. Document the injury descriptively in words. Document what the child said. Document what the parents said. Document the name of the Children's Aid worker and their email address, their phone number. If the police are involved, you need the police constable's name, badge number, their phone number, their email. And then the third part of the protocol is photography. And the RCDSO, the licensing body for dentists, they say that there's mandatory reporting responsibilities. And this comes from the Ontario government, this legislation. It's called the Child, Youth and Family Services Act, CYFSA, says that any person who performs professional or official duties for children, including healthcare professionals such as dentists, and I would say hygienists also, and dental assistants, must promptly report to the Children's Aid Society any suspicions, that's the key word, suspicions, that a child is or may be in need of protection. This is called a duty to report. So we're not called upon to do a final investigation or do investigating we're just obligated to report the keyword any suspicions of child abuse. Professionals should never hesitate to report suspected child abuse or neglect. It is your legal duty to report to a Children's Aid Society when you have reasonable grounds to suspect that a child is or may be in need of protection. And again, here's the concerns include signs of neglect, sexual abuse or exploitations, physical harm, emotional harm. And there could be, under this act, penalties reach $5,000 for healthcare professionals not reporting suspicions of abuse. Under the Regulated Health Professions Act of 1991, the RHPA, you can be charged with professional misconduct for not reporting suspicions, and fines can go up to the maximum of $50,000. So they're asking us that this is the situation, and yet I just came from the Ontario Dental Association annual spring meeting, May 2023, the dental convention in Toronto at the Metro Convention Center. Courses all day Thursday, all day Friday, half day Saturday. 0 courses offered on child abuse recognition and reporting. This is the Sûreté de Quebec. That was their logo. That's the Quebec Provincial Police. And I was trained at McGill University for dental forensics. And I also had training by the Sûreté de Quebec in forensics photography. And this is their setup for taking forensics photography. Here's the ABFO number 2 scale ruler. So you would take a picture of this, for example, this patterned injury that resembled a dentition, that resemble a bite mark, and you take one photograph with the scale and one without the scale. And this is how you would line up the camera perpendicular to the injury with the scale. Now the problem is that a lot of dental offices are using their smartphones for photography, their cell phone cameras for photography. But there's the issue of a thing called the chain of custody. And by definition, the chain of custody is a process that tracks the movement of evidence through its collection, safeguarding, and analysis life cycle. By documenting each person who handled the evidence, the date, time it was collected or transferred, and the purpose of the transfer. So the situation is that when evidence can be used in court, so if the Crown Attorney wants to convict the perpetrator, if evidence can be used in court to convict these perpetrators of child abuse, the evidence must be handled in a scrupulously careful manner to prevent tampering or contamination. The idea behind recording the chain of custody is to establish that the alleged evidence is in fact related to the alleged crime, rather than the defense lawyer accusing us of planting it fraudulently to make someone appear guilty. So the legal concerns inherent to smartphone photo documentation are compounded in cases of child physical abuse. The photos can only be used in court if they are appropriately verified and follow the chain of custody. Now, one of the most common concerns is with these smartphone pictures is the issue of privacy and the chain of custody. And what they found out in a survey by Dr. Chan, did a journal article and found out that dentists and medical doctors who use their own personal smartphones or cell phones to do photography of child abuse injuries, 73% of them stored the clinical photographs alongside with personal photographs in their cell phone. And 26% of these dentist doctors had accidentally shown a clinical photograph of the child abuse injury to a family or friend. And there's also the issue of hacking, of the cell phone being hacked. So, and then, so there's all these issues. So at the moment, if it goes to court and a dental office uses their cell phone to photograph the initial child abuse injuries, it might not be solid enough to be submitted for the Crown prosecutor to use. And again, everything's used for Photoshop to enhance the image and to analyze the image, not to alter the image. And again, wherever you live in Ontario, in your community, you would look up this website, www.oacas.org, to locate the Children's Aid Society to report suspicion of child abuse injury. Here's an example in New York State where it's actually mandated by the licensing body that child abuse course be taken once in a lifetime. And there's other states in the United States where it's actually mandated child abuse training course once every 3 years or your license won't be renewed. And they have in those states also mandatory child abuse courses for dental hygienists also every 3 or 4 years, or your license will not be renewed. No such thing in Ontario. So introduction. So we're going to look at multiple injury, fatal child abuse. So these are all fatalities, post-mortem, pictures from the morgue. And regarding child abuse, they say that child abuse is the dark side of pediatrics. Torn frenum. Here's more post-mortem pictures. I want to camp on this image for one moment to notice that these are documented diagrams from the morgue, that there was actually a total of 57, that's quite a large number, 57 patterned injuries. And we wanted to learn about this because later on in this seminar, we're going to learn what patterned injuries are. We're going to learn what bite marks are. But 57 patterned injuries, 21 bite marks, and 5 that are suggestive of bite marks. And a breakdown of these 57, 18 were linear marks, 21 were contusions, which is also a synonymous term for bruising, 10 abrasions, 20 lacerations, 2 mouth injuries, 1 avulsed tooth, 4 burns, 18 scars. So there's 2 types of abuse victims, those that survive and those that don't. Those that live and those that won't. Those that are rescued and those that are lost. And so we have a responsibility as dentists to be mandated reporters, but there's 2 reasons why healthcare professionals don't report suspicion of abuse. Number one, they have a fear of giving a false positive. And number 2, a lot of dentists are practicing in their own little world, practicing in a vacuum in their local dental office. And they're saying here in this study that 75% of all dental healthcare professionals are not taught or trained in recognizing signs and symptoms of abuse. I would argue that this number is actually higher. I'd argue that it's closer to 95% of all dental healthcare professionals. But it's not only them, but this should be trained in the local dental universities, maybe a 3-4 hour course or a guest speaker, including same thing with dental hygienists, dental assistant training colleges. They should have 3 or 4 hour presentation regarding this topic. So a lot of dental staff look at their boss. Some of them do, not all, but some of them look, and they look at their boss, the dentist, and they say about them, many are just high-functioning morons with good hands. And I would have to say that for some of the colleagues that I know, I would have to agree with this statement. For example, 3-4 years ago, Public Health came out with new IPAC regulations to improve the standards of infection control in dental offices. And some of the dentists didn't want to comply. And they said, I'm not going to do that. I'm not going to spend that kind of money. Oh, this is all baloney. I'm not going to do that. And those are the kind of dentists that don't want to comply, that are high-functioning morons with good hands. But ladies and gentlemen, we are all screwing up. As a result, children are dying. Dentists are not recognizing and are not reporting suspicions of child abuse. But really, in this case, it's not their fault. There's no training being offered to them to learn how to recognize child abuse injuries. So we're going to do an overview of the upcoming topics on this presentation. And we're going to mainly focus in on physical abuse. And there's intraoral, extraoral. There's bruises, blunt force trauma, patterned injuries, bite marks, baseball bat, hammer, boots, shoes, belt cords, and other objects that we can't even dream of. Burns, scalds, dry heat contact, fractures, we're talking about bony fractures, abdominal injuries, strangulation, suffocation, drowning, eye injuries, abrasions, lacerations. And first, we're going to focus in on the category of intraoral, extraoral injuries. And on the left column here, this lists all the extraoral injuries: torn, bruised ears, bald spots on the scalp, broken, bruised nose, hand marks on the neck, gag marks on the mouth, bite marks. And on the right column, intraoral, which might include face and jaw fractures, torn frenum, intraoral lacerations, partially or totally evulsed tooth, intraoral sexually transmitted diseases, palatal contusions. Here's some oral injuries. This fractured teeth, injury to the lips, torn inner lip, bruising of the tongue here, and here's some more oral injuries: torn frenum. This one down on the bottom left, we find out after the dental team took a periapical x-ray, this was actually a broken mandible, broken jaw. There's obviously a avulsed tooth. And so one thing about lacerations of the labial frenum in children, cases with torn labial frenum where abuse was confirmed as the cause, these same children also suffered serious abuse and had extensive associated injuries in other parts of their body. Here's a torn frenum post-mortem. Acute laceration of the upper labial frenum in a 2-year-old boy. The injury reportedly resulted from a fall down a set of carpeted stairs. And one thing you'll find out that many parents are nice people, and sometimes nice people tell lies. Because what we'll find out is that the explanation of the trauma doesn't line up with the trauma that occurred. Because what happened is the trauma that occurred is there's multiple other injuries other than the torn frenum, including a lacerated liver, a humeral fracture were present, and the cause of death was blunt force trauma to the head. That doesn't add up to falling down a carpeted set of carpeted stairs in a stairwell. Doesn't add up. Here's an example of anterior maxillary tooth fracture, lip swelling, laceration, with bleeding caused by blunt force trauma. Here's sexually transmitted disease, a palatal lesion in a 5-year-old, and the histology and the blood work was consistent on the palate with a genital wart, and sometimes they're also known as venereal warts. Here's a trauma to the face, a left side view of the left face, scratch marks and bruising. A torn frenum as seen on a child abuse victim. Here we have ecchymosis of the soft palate, indicative of oral sexual abuse, but we shouldn't jump to conclusions right away. This can also be caused by lollipops or by popsicles. So we need to gently question the child to find out whether or not it was one of these three, and not just jump the gun and say, oh, this is oral sexual abuse. Here's pattern injury. You can't see it really well, but it shows finger marks from the slap mark on the cheek, child abuse injury. So the risk of STD, sexually transmitted disease, in abused child, this is a statistic, is in the order of 5% in young children. And in contrast, for adolescents, it's a rate of 25% risk of STD in adolescents. Again, here's a photo of a tongue lesion and a palatal lesion. And again, the histology and blood work confirmed that this was a genital venereal warts. Here's oral manifestation of genital warts on the lower lip. Again, confirmed by a blood test and histopathology. Here's a syphilis lesion on the tongue, on the dorsum of the tongue. And just a breather, this is out in British Columbia, out in the forest, and a wild bird came down to eat birdseed right off your hand. It's a winter wonderland in British Columbia if you ever get a chance to go there. Marvelous place. We're going to look at a new category, bruising. And by definition, a bruise is visible blood outside the blood vessels in the skin or soft tissues. And bruise or contusion are synonymous names. You can have small pinpoint bruises that are less than 2 millimeters. They're called petechiae. You can have ecchymosis, hematoma, or purpura. Now, bruising 101, why do some people bruise more easily? Well, we need to have, as the dental team, a very thorough medical history before we jump to conclusions. And we need to know the medical history thoroughly. Does this child have bruising that's maybe caused by hemophilia or von Willebrand's disease or something else causing a low platelet count, or Cushing's syndrome or Ehlers-Danlos syndrome, or vitamin deficiencies can cause bruising? So again, we need to have a proper past medical history, knowing about bleeding or diseases that mimic bruising or predispose to bruising. We need to know what medications, current medication update list from the pharmacist. Are they on medications that predispose to bleeding that might cause bruising? And we also need to know a thorough medical history, the family history. Is there any other family members or family history of bleeding problems? And again, it could be a vitamin K deficiency, thrombocytopenia, hemolytic uremic syndrome. It could be leukemia. Could be a skin infection that's mimicking the bruises. It could be insect bites, drug reactions, self-inflicted bruising. So what we're going to look at here, that previous slide was just basically saying that you can't tell the age of a bruise based on the color of the bruise. It's unreliable. But one thing that we can tell is that you're going to see some scars from old injuries and overlapping new injuries, child abuse injuries, beside or overlapping these old injuries. And elaborating on this, identifying suspicious injuries, so that you're going to have a number of old and new injuries. And here's one principle. Unfortunately, physical abuse is rarely a one-time isolated event. And another factoid, and unfortunately, physical abuse is usually a steadily escalating pattern of physically assaultive behavior. And that's why we need to intervene before it escalates to the point where they're in the morgue post-mortem. And so that's why we need to, ladies and gentlemen, that slide where it said, ladies and gentlemen, children are dying. We're not stepping up to the plate. So if we can intervene with a suspicion of these injuries and break the cycle before it progresses or escalates to the death of the child. Here's a picture of showing typical features of accidental injuries. A child might fall playing baseball, soccer, might fall riding their bicycle, typical knee injury, shin injury, elbow injury, palm of the hand if they're bracing themselves as they're falling. In contrast, typical features of non-accidental injuries, these are the kind of injuries that should raise concerns. And I'll let you read this slide for yourself while I read this down on the bottom left where it says concerns are raised. So it's a red flag if injuries to both sides of the body. It's a red flag if there's injuries to soft tissue. It's a red flag if there's injuries with particular patterns, patterned injuries. And it's a red flag if the parents or guardians have left the injuries untreated, or there's been a delay in them getting to get medical attention for these injuries. Those are all red flags. Sometimes it's bruising, but it's caused by cultural practices such as cupping, spooning, or coining. Now there's two types of bruise. There's subcutaneous bruise and a deep bruise. And the subcutaneous bruise is the most common type of bruise. It's where bleeding occurs in subcutaneous tissue. And they usually appear soon after an injury occurs. And as we know, in the dental world, bruising peaks 48 hours later. So the dental team might be the first one to photograph this injury, suspicion of this child abuse injury, this bruising. And then either the hospital photography team or the forensics teams of the police would take over, and they would continue photographing this bruising over a 72-hour period. And then there's the deep bruise where the bleeding is in deep subcutaneous tissue. And these don't always manifest themselves right away. And therefore, sometimes for us to photograph a deep bruise properly, sometimes infrared photography needs to be used. There's bruising on the ear, suspicion of child abuse injury. And you always need to check behind the ear that there's often, when there's pinching of the ear, there's often bruising behind the ear also. Here's a 7-year-old girl with discoid lupus. This here could mimic a burn or abuse, but it's not. It's discoid lupus. Here's a child that was slapped on the side of the head with a ruptured eardrum, blood coming out the eardrum. Bruising on the thigh. Again, you'd have to ask the child or adolescent questions how that bruise occurred. Here's a young man where there was bruising to the scalp, to the forehead, to eyelids under both eyes. There was bruising to the mastoid process, the ear, and the preauricular area. Here's a young boy where there's purple, brown, irregularly shaped bruises on the arms, 2 linear red marks on the chest, and a red mark on the chin. 2 of the marks on the left arm have a linear appearance and they resemble possible pinch marks. Again, here's this suspicion of child abuse injury. We would never, obviously they're going to be wearing a shirt, but we would see the bruising on the neck. We would see the bruising behind the ear. So again, child abuse is highly suspicious when there is more than one injury over a period of time, or when the child has suffered different kinds of injuries, where the explanation by the parents or guardians keep changing, where they live in a toxic home environment where there's frequent disturbances or domestic violence in the home. And again, another principle, you don't bruise until you cruise. So if you have an infant, they don't cruise around, they don't crawl, they don't walk, they shouldn't be having bruising. So any bruise on an infant is a big red flag that it's a suspicion of possible child abuse. We're going to look at a subcategory of bruising, patterned injuries. And by definition, a patterned injury, this is a type of bruise that reflects the pattern of the striking surface. And these type of patterned injuries actually have a high medical legal value for the Crown prosecutor to use as evidence against the perpetrator in court. Now, these patterned injuries could be caused by human hand marks, for example, grab marks that are oval shaped. The patterned injuries could be caused by strap marks, and you'd get sharp bordered rectangular bruises. They could be caused by lash marks, loop marks, gag marks, or circumferential tie marks. With circumferential tie marks, they're on the ankles or wrist when a child is restrained. With gag marks, it's usually abrasions near the corner of the mouth. And with loop marks, it's usually by being struck with a lamp cord or a rope. Lash marks are usually thrashing with a tree branch or a stick. And the patterned injuries, the mechanisms, it could be a crush, a bruise at the site of contact, and that might be caused by biting, pinching, or grab marks. So when we say bite, that's a bite mark. It could be caused by a mechanism of a high velocity impact, such as a hand slap, being whipped with a looped cord or a hanger. Could be a mechanism of pressure changes that might cause a hickey, or from strangulation causes these type of petechiae. It could be an incised wound or a cut. It could be a laceration, indirect forces spanking, or it could be a black eye. Here's some of the common tools used by perpetrators that cause these kind of patterned injuries caused by these instruments: a belt buckle, a belt, looped cord, stick or whip, fly swatter, coat hanger, spatula, the actual hand, the fist or brass knuckles, bite marks, saucepan, paddles, hairbrush, metal spoon or wooden spoon. Again, the ear injury here, and also check behind the ear. Again, these are inflicted ear bruises that occur when they are pinching, pulling, twisting, cuffing, or punching done by the adult perpetrator. Again, we've seen that one before, a repeat bruising behind the ear. Here's so bad where there's repeated ear trauma that some children actually develop what's called cauliflower ear. Here's a whipping, a loop mark caused by an extension cord, being whipped with an extension cord. That's the traumatic injury from this child abuse injury. Now, some children are actually kicked with shoes. And in this upcoming image that we're going to see next, you're going to see a healed patterned bruise on his back, as well as linear marks that are suggestive of marks from the edge of the sole of a shoe. So this, again, this is from a shoe and the edge of a shoe where the child was kicked in the back, kicked and stomped. Again, the slap mark to the face, patterned injury with the finger marks. Here's bruising, a handprint to the face, patterned injury. Here's bite marks on the inside of the left thigh. Here's whipping marks and caused by an extension cord. Belt marks on the back, obviously caused by a belt. Bruising. Patterned injury. Here's dog bite. This is a post-mortem child homicide where the incisors from the dog not only did bite marks but tore the scalp wide open. So multiple dog bites from this dog to the head and scalp and the ripped scalp from the sharp incisors. And again, for court, and that the owner of this dog might be prosecuted, and they take very thorough, they actually take impressions of the dog teeth to see that they line up with the incisor marks on the skull of the child. Again, interesting, this is a human dentition, a bear dentition, a mountain lion dentition, and a dog dentition. Another patterned injury is from cigarette lighters. This is the type of pattern injury you'd see in this case on the child's foot and on the child's thigh and lower leg. Patterned injury caused by a cigarette lighter. Here's little circles caused by being whipped with a belt by the perpetrator. The patterned bruising. And this was the belt that caused that pattern bruising with the circles. This young lady had all these little round dots on her chest, and they were suspicious that it might be caused by child abuse, but they found out that she fell asleep on top of the television remote control, and all those little round dots on the chest were caused by this TV switcher television remote control. Here's the classic oval bruising caused by grip and pinch marks on the upper right arm of this adolescent. Here's bite marks, clinical symptoms and signs and symptoms of abuse. And if you try, which I did, I tried to bite my own arm, and it's so painful, it's impossible to give yourself a bite mark. So imagine how painful one bite mark is, but these children are so severely abused, it's bordering on torture that you be bitten that many times. Here's more bite marks on a thigh, the arm, the shoulder, the face, whip marks, patterned injuries. This is misspelled here, but it should say the letter N in there. N for Nancy. Patterned bruising. Here's some children are abused and beaten with a hairbrush. In this case here, this was a fatality of a child, cause of death, blunt force trauma. But again, they were also beaten with this hairbrush. There's the patterned injury on the skin caused by the hairbrush bristles. Again, that was a bite mark. Here's the circumferential marks on this adolescent's arm, suggestive of a cord was used as a means of restraint. Here's a case from decades ago from St. Louis showing all the different, there's an electric cord, there's a belt, there's all the different instruments that were used to beat the child. And this is the child that was beaten. And it was a nationality with a dark skin color. And so sometimes for Photoshop analysis and enhancement to analyze these injuries, we go grayscale, black and white, and quite often it's more easy to analyze black and white image and analysis enhancement using a Photoshop software to prepare the evidence for court for the Crown prosecutor to prosecute the perpetrator. Here's anterior neck demonstrating a fresh abrasion as well as some old hyperpigmented linear marks consistent with repeating chokings. And actually, choking is when you choke on a hot dog or choke on a piece of chewing gum. It should say here strangulations, and actually it should say repeating non-fatal strangulations. Here's a bite mark with a hickey on the top left image. Here's a patterned injury possibly with a belt, a patterned injury with a heated loop on the forehead. We're going to look at eye injuries. Eye injury under the eyelid. And here we have a subjunctival hemorrhaging. And the subjunctival hemorrhaging could be caused by sometimes just straining too hard, for example, coughing too hard, or could be caused by trauma to the eye, or this could be caused by non-fatal strangulation, where there's a venous pressure buildup in the brain caused by the strangulation and manifests itself as subconjunctival hemorrhaging of the eye. So again, physical findings documented after strangulation. Again, you get this subconjunctival hematoma. So this could be also caused by strangulation of the child. Another image of a child with this condition. We're going to switch topics and look at fractures. And there's even many textbooks, but here's an example of one textbook entitled Radiological Atlas of Child Abuse. And so it shows all the different broken bones that can happen during child abuse trauma. And again, in this case here, they took radiographs, the dental team. It was a broken jaw as seen on a victim of child abuse. So sometimes you'll get a spiral fracture of the femur, and that's caused by pulling, twisting injury. You can get metaphyseal fractures caused by twisting, pulling, yanking, traction forces. And just want to focus in on this part, that fractures are most commonly seen on the ribs, the skull, and the long bones. One kind of fracture of the skull is called a basilar skull fracture. And they are fractures that are located on the lower half of the skull. Damage to the meninges at the time of the impact causes bleeding into the sinuses, and this bleeding then follows the path of least resistance and leads to blood pooling around the eyes. And this is medically, the term is bilateral periorbital ecchymosis, but it's also called raccoon eyes or panda eyes. And these again are not caused by punches. They're not black eyes. They're caused by basal skull fracture. Here's panda eyes or raccoon eyes caused by a basal skull fracture. Again, panda eyes, raccoon eyes caused by basal skull fracture. They shouldn't use this terminology, bilateral black eyes, because these are not. This is basal skull fracture. They're known as panda eyes or raccoon eyes, or the periorbital ecchymosis. This is something else you see. This black crescent-shaped bruising behind the ear is known as a Battle's sign. And it's a manifestation, it could be a manifestation of a basal skull fracture, or it could be from the disruption of the posterior auricular artery. So you get a basal skull fracture and the posterior auricular artery is disrupted, causing this kind of a crescent-shaped bruising, and it's definitely black. However, it's possible that the blow resulted in the basal skull fracture was directed to the ear. And then again there's a Battle's sign, and the infant who has scalp bruising and swelling, and this time it wasn't basal skull fracture, it was parietal skull fracture. So why are we looking at an infant? Well, my practice, more parents are calling saying, I would like to have an appointment for my 1-year-old to have a checkup. And a lot of the literature, as we know, is also saying bring in a 1-year-old for a checkup, where the old school was bring the child in at age 3 for an exam. Again, repeat the bruising behind the ear. So in summary, basal skull fracture could be caused by, number one, a motor vehicle accident. It could be caused by sports injury. It could be caused, number 3, by blunt force trauma. Number 4, it could be from the child being sodomized, brackets, violently forceful anal sex can cause a basal skull fracture. And number 5, it could be caused by any other sources of head trauma. And they would do a CT scan with a 3D reconstruction showing where the depressed skull fracture is. Now, unfortunately, the large corporations made up, this 1 year, they made up cosmetics where women could have panda eyes, raccoon eyes, and it's almost like forgive me for saying, the Illuminati. They want to mock children being abused and having children that have basal skull fractures. And the panda eyes, this happened in 2008. The thing is, this is a crime. This is not a fashion trend. we're going to switch topics and look at emotional abuse. Now, emotional abuse is apathy towards, they're apathetic towards the child's needs. The guardian or parents are withholding physical or verbal contact. They're confining the child. They're abandoning the child in public places. And in this case here, this little boy he was tied to the chair every weekend, Saturday and Sunday, and then he was allowed to go to school Monday, Tuesday, Wednesday, Thursday, Friday. But when he went to school, he rationalized this by telling his classmates, I was in jail for the weekend. But this is definitely child abuse. This is more than emotional abuse. This is child abuse, and it's bordering on torture. And that's where we say this other principle that all child abuse, in one way or another, it always involves some emotional abuse. We're going to switch to sexual abuse. And we need to note that sexual abuse is not limited to penetration, and most children who are victims of sexual abuse do not have physical signs of such abuse. And here's some statistics that some children by age 13 years of age, by the time they reach age 13, in the females, 2 out of 10 females have been sexually abused. And by the age of 13, 1 in 10 boys have been sexually abused. And most sexually abused children are abused by family members or close friends. And they say that stranger danger is quite rare by comparison. I would beg to differ, and I would say that it's still important, and you would agree with me, that it's still important to teach children about stranger danger. And again, as dental people, we're never going to be doing the genital area. That'll be done by a medical people at the ER or by a forensics nurse. But it's interesting to note that even in the genital areas, they do bite marks. Now here's an 8-year-old boy who reported being choked, and again that word should be strangled, by an adult while being sexually abused. So they're being sexually abused and strangled at the same time. And again, the patterned finger marks support the history of choking. Again, I would beg to differ. I would say these are thumb imprints while the child was being strangled. The fingers spread out here and the thumbs engaged here. And of all the digits on the hand, the thumb is the most strongest digit. That's again the position. The thumb would bruise here and the other thumb would bruise over here, because that's the most commonly used hand position for manual strangulation. Again, this is a mannequin that I use at the office. We did some photographs to demonstrate strangulation. Again, the thumb engaged here, the thumb engaged here. You'll have a thumb bruise here and a thumb bruise here. Again, this is a thumb fingertip bruising. And again, here's the textbook. This is pretty well what I call the Bible on strangulation on that specific topic. And that's again, it's domestic violence, but it also applies to child abuse. And the proper terminology is non-fatal strangulation. And again, choking is only if you're choking on a sandwich, choking on a hot dog, choking on chewing gum. Again, I apologize for the quality of this image, but again, any palatal petechiae should be suspicion of forced oral sex. Again, this young lady, we'll see her face, we'll see the bruising, we'll see the trauma around the lip here on the right side. In addition to the marks and sutured laceration of the cheek, the child had bruises to the shoulder, the back, and the left arm. The child stated that her father attempted to insert his finger into her genitalia, and when she resisted, he hit her. Her genital examination was normal. Many forms of sexual abuse do not cause physical injury. Again, here's a 15-year-old female with evidence of attempt, and now they finally use the proper terminology, with evidence of attempted strangulation. These scratch marks were like this here. The victim was doing self-defense, trying to scratch away the hands of the perpetrator. because when you're being strangled, your very life flashes before your eyes and you think you're going to die. And one of the other things that a victim will do, they'll go like this here, bang their chin down on the arm, like this here, to try to get the hands away of the perpetrator, and many will end up with a bruised chin from doing that. Again, here's where a ligature was used. This is a child homicide, and this looks like it was consists of a telephone cord. And in one case, another case, they were strangled with the cord of the bikini top, and sometimes they use a wire, but in this case it was a telephone cord, and this cord has left these physical bruising, but this is a fatality. This is fatal strangulation. Again, here's a 15-year-old female with suction marks on the neck post-rape. Again, a repeat slide, ecchymosis of the soft palate indicative of possible oral sex abuse. So words matter. And this newspaper article said that the teacher had sex with the girl, but it was a 14-year-old girl, so that's an adolescent. What really should be said is they corrected this. The teacher sexually abused the child. There was grooming and sexual abusing and abuse and abuse. It's not a relationship, it's abuse. And it's grooming and sexually abusing. So they fixed that because sexually abusing a child is not a sexual relationship, it's child abuse. Again, many of these children, when they grow older, they're going to have PTSD, especially when they're involved being sexually abused as victims of human trafficking. They'll have nightmares, eating problems, anxiety attacks, intrusive thoughts, periods of sadness, depression, thoughts of hurting self or others. They'll start to do self-harm sometimes, and they'll have chronic unexplained pain, headaches, abdominal or back pain. Just a time out here, this is the beautiful Niagara Upper River in the summertime, and there's awesome, excellent fishing in the Upper Niagara River. We're going to switch topics and look at burns, scalds, and dry contact burns. Again, these are the common tools used by perpetrators to cause burn marks, and by means, this is not all inclusive, but it could be a hot plate, a hot light bulb, a curling iron. Back in the 1970s, cars had cigarette lighters. Could be a burn from that. An iron, steam iron, a hot knife, grill instruments or the grill itself, cigarette burns, a heated up fork, or immersion of a child into a bath where the bath water is scalding hot. Again, here's some example images of burns: cigarette burn, cigarette burn, cigarette burn. It looks like a steam iron burn here. Cigarette burn on the foot, sole of the foot. Again, injuries caused by cigarette lighters. Again, these patterned injuries cause burns by cigarette lighters. Here's, not only do they do it to children, they do it to animals. Here's a story where sick thugs torture a cat with cigarette burns, forcing tail and ear amputation of the cat, the house pet. Totally evil, totally sadistic. That's a crime. Here's where somebody heated up a fork and caused this burn injury. Somebody heated up this loop, a perpetrator, caused this burn injury on a child. Here's an 8-month-old female was raped and burned with cigarettes on both hands and on the right sole of the right foot. Sexual abuse. Here's a burn. And if it's an accidental burn, it would be just a burn in one spot, but these are burns over the entire child's body. That's child abuse. That's not an accident. Here's the cigarette burn, typical appearance, 0.8 to 1 centimeter diameter with a smooth, well-defined edge. And in contrast, impetigo, it has to be distinguished from burn marks. Impetigo has crusting at the edges. It's not well defined and is an epidermal lesion that heals without scarring, whereas cigarette burns, when they heal, there's always a scar. And we find out that multiple cigarette burns remain highly specific for child abuse. A single burn might be accidental. And we also find that cigarette burns were frequently accompanied by other injuries, for example, multiple blunt force trauma injuries. Burn to the palm of the hand. Here's the wound where cultures were negative, so there was no infection, but this child will have significant physical and emotional scarring from this heinous abuse. And this was reported as torture. Here's a contact burn to the chin. Here's the immersion in the bathtub. That's what happens when a child's immersed in the bathtub, the burning and scalding, where they've been placed into a bathtub where the temperature wasn't checked. New topic, neglect or failure to thrive. And you might see underweight conditions, failure to gain weight at home, ravenous appetite, failure to thrive doing underfeeding, abdominal distension, that you look in their eyes, they have that vacant stare, the skin lesions from malnutrition, and another kind of neglect we always see, dental caries caused by neglect. New topic, parents as perpetrators. And again, as I said early in the presentation, many parents are nice people, and sometimes nice people tell lies. So the parent might offer conflicting, unconvincing, or no explanation at all for the child's injuries. They show little concern for the child, and they'll blame shift and say that the child's entirely bad. They'll deny the existence of the problem itself, or they'll blame shift it that the child, it's their fault they have problems at school or they have problems at home. They'll use harsh physical discipline. There'll be a toxic home environment where there's domestic violence, drugs, alcohol abuse, or mental illness. And might I comment on the drug use, that if a mother, it's in the literature, if a mother uses cannabis, marijuana on a regular basis, it destroys the maternal instinct. It destroys the mothering instinct. And that means that mother doesn't care about their children anymore. And that leaves those children unprotected and more open to child abuse from an ex-boyfriend, a new boyfriend, an ex-husband. All the men and sometimes women abuse children also. So all the people that travel through that house or apartment connected to that mother. Bad news, she's lost her mothering maternal instinct. So again, the parents or guardians, the story will not make sense in relation to the injury. The history is not consistent with the child's abilities. There's no history for significant injury given by the parent or guardian. You've seen multiple injuries possibly at different ages. That's a big red flag. And again, any infant that has bruising, burns, or fractures or mouth injury, big red flag. They're not old enough to cruise. So this shouldn't be happening. Highly, highly big red flag that there might be child abuse of that infant. So again, these parents, they don't seem to trust anybody. They're reluctant to explain the child's injuries or conditions. And when they do, the explanations sometimes are so far-fetched or they contradict themselves. They respond inappropriately to the seriousness of the child's condition. Sometimes they overreact, or sometimes they even become hostile if members of the dental team question the parents. And then here's just some of the reasons why children often never tell about the abuse. They never report it. They never tell anybody. They're saying here 90% of children don't tell. And maybe it's the perpetrator saying, you better not tell her, I'll kill you, I'll kill your sister, I'll kill your mother if you tell. So they're going to be scared. They might say, it's my fault. This is like a child has faulty logic. They're going to think that no one will believe them. Or there's fear that if they do report it, they're going to be taken away from their home and put in a foster home. So all these different reasons why children often don't report. Again, sunset on the Upper Niagara River. We're going to look at one We're getting close to the end of the presentation. Bear with me. We're going to look at extreme neglect. So some children live where there's drugs in the house and addictions and domestic violence, but some children actually live in a meth lab. And they'll say, oh, he has the flu, he has the flu. It might be meth contamination that they have. Here's a former daycare provider charged with child abuse. Here's this couple, this married couple that were so addicted to this video game, World of Warcraft. They were totally obsessed with it, so severe that they just totally ignored their children, extreme child neglect. And the children were injured, and these mother and dad were put in prison. Here's where a Michigan man was sentenced for abusing his ex-girlfriend's baby, leaving bite marks and fractured ribs. Here's a teen testifying to being beaten with a hammer and an extension cord. So thank you again for your kind attention. And if you have any questions, you can email me at jamesfrizzell983@gmail.com. That's jamesfrizzell983@gmail.com. Thank you for tuning into the YouTube channel. If you like the channel, please press like, and have a good evening. Thank you from Niagara Falls. Have a good night.